Hello everyone, welcome back to my channel. For those of you who don't know me, my name is Beck and I'm a third year nursing student in Western Australia. I have done about 5 placements. I have 2 more left of my whole entire degree. I decided that I was going to do a Q&A on my med surgical placement. So anyway, I'm going to jump straight into the video because I don't have a whole lot of time. And if you hear noises in the background, it's storming. And the sunlight's going to change a bunch, but we're just going to roll with whatever we can do because I am on holidays and I don't want to spend too much time thinking about uni. Just to provide a little bit of context on the ward that I was on for my med surgical placement, I was in a smaller city hospital. I was in a private ward, so it was probably a little bit different to a general public ward. It was, I think, maybe a 20-bed ward. It was my second ever placement, so it was last year, July. I really enjoyed it. It was my first hospital placement, so it was the first time I'd been in the hospital setting as a student nurse, and I was so nervous and I was so concerned about everything. Like the first day I was just like I went into the ward and got introduced and got orientation and everything like that, and then I got placed with a nurse who was in the room with the patient. And so my preceptor took me in and she's like, oh, can Beck be with you for the day, like can she be your buddy for the day? She's like, yep, no worries. And she's like, oh, have you done like vital signs before? And I was like, yeah, I've done vital signs heaps, like of course. And she's like, all right, do you want to do them on this lady for me? And I was like no. No, I was like freaking out because it was the like normal machines, you know what I'm talking about, like the automatic machines, rather than having all your manual vital sign equipment there. So I'd never like pressed any buttons on the machine or knew how to pop the blood pressure cuff up or anything like that. So it was quite nerve-wracking, but I just explained to her, I was like, look, this is my first placement. I've actually never used these machines before. Are you able to just give me a quick rundown? And the patient was fine, and my buddy nurse was lovely and she ran me through it, and after that I was sweet. Initially when I first started, I didn't have any patient load, nothing like that. I was basically just doing anything to help out the nurse, which was mainly vitals. To the last week I was doing med rounds, had my own patient load, doing wound care, taking patients for surgery, like stuff like that. So that's that. So now I'm going to jump straight into the Q&A. Okay, the first question is, what surgeries did you do while in your placement? For the med surgical rotation, I didn't actually get to go to surgery at all. I was dealing with pre-op and post-op patients, so it's a little bit different than doing a theatre placement, so that's probably a bit confusing. But one of my friends who was on the placement with me at the same time, she got to go see a gallbladder removal, so a cholecystectomy. I'm probably pronouncing that wrong. And she got to go into the theatre and everything and see them take the gallstones out the gallbladder, and she got to help pick them off. So there was that. But you had to organise it with the manager and the coordinator, and you had to organise it with the patient and get consent and stuff like that. And my passion isn't theatre nursing, and I didn't really want to go see a theatre because I had a GP clinic where I was able to see mini theatres, and I don't know, I'm not really interested in it, so I didn't push it, whereas the other girls were really passionate about it and they pushed it, so they got to go see it. Was it a fast-paced environment? It definitely was a fast-paced environment. Further pracs since then have been faster paced. I'm interested in all of your info for your placements. How many days are you there and how many hours a day? I'm from the US and I think our placements are different. We go for 3 weeks at a time, 8 hours a day. So we're rostered on, as if we're a nurse on the ward, we're rostered on like that. We have an 8-hour shift, we have a half an hour break and a 15-minute break, and we're there for 3 weeks at a time. Sometimes it'll be 2 weeks at a time, and sometimes it can be 4 weeks at a time. What would a typical day for a nurse in the OR/surgical ward look like? So like I mentioned before, I wasn't in the operation room, so I wasn't in the theatre. So with a surgical ward, it mainly looks like you'll go in and you will do your 7 o'clock handover, 7:30 showers, 8 o'clock meds. A lot of the time on the surgical ward, meds are strict because if they're fasting, they're either holding off on their medications or they're having them quickly if they have to have them, or they're not having particular things like aspirin or Clexane because when they're going for theatre, they can't have blood thinners. So that's a little bit different. And then you also do pre-op stuff. So for the hospitals in Australia at least, you have to put TED stockings on your patients. You have to put a name band on their foot, on their wrist. You have to make sure they haven't eaten, do the set of obs. So you have to record all of this. You're also making sure that all their valuables are put away, all of their medications are charted. You're doing the meds, doing their pre-op checklists, and then they'll get picked up for theatre, and then afterwards you will get a call to be like, hey, your patient's ready, and then you have to go pick them up. They're usually quite out of it because they're still waking up from the anaesthetic, but usually when you come and pick them up, they'll be ready. So you'll go pick them up, get handover, you'll do a set of obs on them, you'll make sure that they're safe to transport back to the ward, and then when they get back to the ward with you, you will offer them food, offer them drinks once it's been a while since they've been back, see how they tolerate that. Some people get really queasy after surgery, so they don't genuinely like to eat, but you've kind of got to get them eating because that's your goal. So your goal is to get them up, get them eating, get them walking around if they haven't had a surgery that stops that. Also with a surgical ward, when you're getting them back from theatre, you're doing 15-minute obs for an hour and then half an hour obs for 2 hours after that, and then they go back to their normal 4 hours. So that's kind of what a normal day looks like, I guess. Another thing that's different is you're doing neurovascular obs. Whew. Is there any advice you have specifically when treating med-surg patients? I guess my biggest piece of advice, but it's kind of broad, is getting to know your care plans. So you have like a piece of paper, so it's got beds, so beds in patients, and then it's got times across that way, and then so you can put in everything you need to do, and it just makes the day run so much smoother because you literally just cross things off as you do them, so you're not forgetting. And if a patient comes up to you and says, oh, can I please have a drink of water, you go to that care plan. If you don't have time right then and there, you write it on the notes part, and that way you don't forget, because forgetting stuff for your patients is so important. I guess delegating and not being afraid to ask for help. Because med-surg is so intense, don't be afraid to be like, hey, look, I need to go pick up my patient for theatre, but she's really not doing well. Are you able to just keep checking up on her or answer my call bells while I'm gone? Like, that's probably the biggest thing, is not being afraid to be like, I need help, and not just being like, I can do everything. Just, yeah, because at the end of the day, that's going to put your patients at risk. What did you mostly see? I have mine in 2 weeks. Gallstones, like cholecystitis. Again, I can't say the word cholecystitis, so I saw a lot of hysterectomies as well. So they were mainly the surgical patients that came in, they were for hysterectomies, exacerbations of COPD or asthma. We saw TURP, so transurethral resection of the prostates. We saw palliative patients that couldn't be cared for in the aged care home. That's the main thing that we saw, I guess. How was the adjustment to the med-surg placement? It was good. It was my first hospital placement, my first experience dealing with people in the hospital setting, so yeah, it was a big adjustment anyway. So the med-surg factor wasn't like, it was just as normal for me because I was like, hadn't experienced anything else. So yeah, it was pretty good. If I had done a surgical placement first, or I'd done a pediatric placement or something like that first, then the adjustment, I guess, would be a bit different because you are dealing with different kind of patients and dealing with different issues. What did you do every day on a med-surg placement? So yeah, I've covered that one already. That's 8 o'clock meds, toileting, showering, medications, wound care, pre-op, post-op checklists, and stuff like that. Worst moment and bits you didn't enjoy. I guess a lot of people would say that the showering and the toileting were the bits that people didn't enjoy the most. But to be honest, for me, the thing I didn't enjoy the most was, I had a patient who was dying. She was not in a good way. She was in her 90s and she should have been put to palliative. She, I think, had multiple cancers, COPD, the whole works. She had everything, and she really should have been palliated. She was still being given antibiotics, still being given steroids, still being given everything, and it wasn't doing anything, it wasn't working, and she was just in agony, being kept alive basically by her family. And that was probably the hardest thing for me, because I get that it's hard when you have a family member. Like, I personally have had a family member who's been palliative, and that was the hardest thing, to see someone who you love and who everyone around you loves being put on palliative care, which means that there's nothing you can do about it. Like, that is hard, and so I totally get it. But seeing someone who's in their 90s who wanted to die, she kept telling us she wants to die, and there was nothing we could do about it because her family wouldn't allow it. So that was the hardest thing for me. yeah, a lot of people say that dealing with poo is hard, and I really don't. I'm not bothered by it because I don't see it as you're cleaning someone's bum. I see it as there's a person in front of you who's having the most least dignifying thing happen to them, where they're either in a bed soiling a pad and they can't do anything to make it better. And I think of myself in that situation, and if I had someone coming in here into the room and being like, that's gross, and then telling all my friends that's like the grossest thing about nursing, that would feel even worse for me. So that doesn't really bother me. Like, I don't see it as cleaning someone up. I see it as helping someone through a tough time, or helping someone in their final days when they can't do it themselves, and giving them a good experience with it and treating them with respect and dignity. So yeah, anyway. Okay, I've got one more question here. Are you squeamish at all? Did that impact this placement, and what type of things did you see? I didn't think that I was squeamish, but if you check out my other video on my theatre experience, I was in a GP clinic doing a small theatre day procedure clinic, and I threw up. So no, I'm not squeamish, but that happened. So yeah, I don't know. For this placement, however, my medical surgical placement, I didn't see many things at all. We saw a patient who had a nail through his hand. That was the coolest thing for me ever. So I feel like if you were squeamish on a surgical ward, it wouldn't matter because you don't go to theatre. If you're gonna do a theatre placement, if you tell them you're squeamish, as long as you sit down when you do feel sick and you don't push yourself and you don't end up passing out in the theatre room, then you're fine. So yeah, I hope that that answers most of your questions. I might do an updated one in the future when I'm maybe possibly a medical surgical nurse. For anyone that is wanting to do medical surgical nursing or going into a med-surg placement, just go in with no expectations. Be excited, get to know your common illnesses and get to know your pre and post-op admission stuff and stuff like that for sure. Like, prepare yourself, because it really is an amazing placement. I will be doing another Q&A on my GP clinic placement, my aged care placement, my mental health placement that's coming up, and then I'll be doing like probably a few videos on my Royal Flying Doctor Service placement, because I'm going to be so excited. I am ridiculously excited for that one, so I probably will be doing a few videos on that in the future. I've got videos on what to bring on placement, so definitely check that out, because there was a few questions in there asking what to bring, and I've kind of covered that in my what to bring on placement video. I really hope you enjoyed this video, and I hope everyone has a wonderful day. So bye. Mwah.